Good evening, everyone. Thanks for sticking around. I'll, I think I, any better now? Perfect, thank you. So, what I want to talk today about is about Kollitech for 30 seconds, and then I'll talk about our flagship product, which is called GPRO. So, as many of our leaders talked here about the AI and how it's going to be impacting our ecosystem, what Kollitech is doing is like trying to navigate each of the organization who want to go with AI. So there are many caveats, audits, making sure AI is being implemented the right way. So current rush is like gold rush. Everybody want to get their hands on AI, but a lot of people are not taking into consideration what are the repercussions of going wrong side of the AI. So we saw an example a couple of weeks ago about OpenClaw. So that is just the tip of the thing. So we need to do the right way of AI in healthcare, and we don't have to rush to it. AI has to bring a lot of good things. A good doctor said to me, like, live for 10 years, you'll live forever. So that's what AI is going to do for us. So, but doing the right thing with AI is the most important thing. So I want to talk about our GPRO today. GPRO, we built in an ecosystem called Healthcare Without Borders. Today, our data is living across different electronic medical record systems, or on paper, or sometimes on a medication strip if we are traveling across the countries. So what we are doing is like this system is going to integrate everything, put it in a structured format, easily readable by any doctor, any provider, and any country. So imagine you are traveling in Japan or Shanghai, and either your family member or yourself got sick or need a doctor. So our medical records are not carried everywhere. So you don't own the data. Either you carry a bunch of packet, even our luggage is not allowed that much. So you are captured with the data locked in the States. But what if somebody needs to review your medical history, know your allergies, know your current medications, and provide the right care? So that's where GPRO is going to fill the role. And the name we gave, G stands for global, and provider goes with PRO. So you have a provider, you choose anywhere in the world. As a patient, you own the data. You decide who you want to share with. It could be your chiropractor, it could be your, it could be your therapist, or it could be your a physician. So you segment the data and share it across as you want. I know this is not working somehow. Thank you. So there's a big gap. The people travel frequently, like people coming to states, and even our parents are visiting, our conference are happening, and a lot of people come and visit the CES conference. There were like more than hundreds of thousands of people came to CES in January. And people opt for travel insurance, but they don't understand how much it covers, how much the cost of if anybody run into an accident or an issue, the insurance cost of coverage. These are all things that GPRO is going to fill the gap, where the patient doesn't have to worry about what the situation would be. Like an employee traveling across the globe, like they would be carrying the coverage, but they don't know which doctor to go if they are in a different country or a new country. Even if anybody coming to US, they end up going to ER, or after that the follow-up visit would be a nightmare. So we are trying to bridge all those gaps in a sequential way, and communication and privacy are our priority things. So I worked in healthcare for the last 20 years in implementing electronic medical records. So my priority first thing is the privacy of the data. So we built the product ground up with the pillar of security, privacy, and I also work with State of California as a privacy officer. So I do understand all those guidelines, what we have for the state. So when we were building the product, we made sure it is all fully owned and controlled internally in the states. The data is living in the states, and we are trying to get ourselves SOC 2 compliant, which it gives us a more power to approach any business and entrepreneurs to add GPRO as a tool for their HR employee section. That way, whenever they are sending their employees anywhere into the country, they would know. So to be precise, we built some tools. A funny thing is, like, we have a baby crying here. So, but it's a broad daylight. We all know baby is crying. But normally, if the same situation happens in the middle of a night, what would a mom do? What would a dad do? It's like, what's their symptom tracking? What they need to help? So that's the AI piece we are bringing in, and we are adding it on the layer. So we would also suggest things like, we start with the kitchen. All our kitchen has a lot of medication. Our grandparents told us a lot of things. None of us remember any of those. So these of the AI we built is like, first tells you what you could do on your symptom. So it's like, it doesn't tell you I'm having a cardiac arrest, don't go take a kitchen. But if you're having a cough, if you're having a light fever, what are things you could do? So that's how we built GPRO. And I would suggest, I know everybody's tired, I could tell because I'm myself tired, but please visit gprob.com. It will give you additional information. I know the time is limited, but there's more you could learn over there. Thank you all. Appreciate it.